Welcome to Face the State. I'm Ariana Bennett. Thank you for joining us. When major health issues pop up in our area, like the measles scare earlier this year or flu season every year, it's up to the Washoe County Health District to respond. Its officials also work to keep us healthy all year long. So how does Washoe County stack up in terms of health, and where do we need to improve? The Washoe County Health Officer Kevin Dick is here now to talk about that with us. Kevin, thank you so much for coming on the show.
Well, thanks for having me, Ariana.
So speaking in general terms, how healthy is Washoe County?
Well, generally I would say that we have pretty good health. Recently there was a county health rankings, and the Washoe County ranked third in the state of all the counties for health statewide. So I think that bodes pretty well for us, but we certainly have areas where we could improve significantly.
Now, is Nevada generally regarded as a healthier state, or are we kind of in the middle somewhere, or on the lower end?
It's Nevada typically, when it comes to health issues, it's similar to education. We rank fairly low nationally. We do have some areas where we do very well. But overall, our state invests very little money in public health compared to most of the states in the country.
I know some of the big indicators of that are things like nutrition, smoking, obesity, high levels of that all across the board, would you say?
Yeah, we're actually not as bad as the rest of the nation when you look at obesity, for instance, but certainly we still have a very high level of obese or overweight in the population. And just not being as bad as a very overweight and obese nation is not a good thing.
Yeah, and I know we're high in smoking. I know we've done
Yes.
stories on that in the past. What about nutrition? How do Nevadans do in nutrition?
Not very well. I couldn't tell you exactly how we're doing compared to the rest of the nation, but the number of people that are eating fruits and vegetables as a significant and major part of their diet is very low. And I think if you look at the health issues that we face as a county, as a state, as a nation, it's really not so much health care, but it's people's behaviors and socioeconomic conditions that are the major determinants of health outcomes that we see.
Yeah, and that's a tough thing to combat, I know. What would you say are the biggest health issues that we face in Washoe County?
Well, we have chronic disease, of course, is a growing problem, and that's tied to the overweight and the obesity. If you look at the major causes of death that we have in Washoe County, we have heart disease, we have cancer, we have a lower respiratory disease, but we have them at higher levels here in Washoe County than we do in the rest of the Nevada and in the nation. So those are all areas where better nutrition, more active lifestyle can help. Cancer is sometimes a wild card with genetics and those types of things, but again, what the decisions that people are making can certainly help them.
Yeah, it's an uphill battle, I know, fighting that, because it's so much of it is cultural and tied to people's knowledge of what actually is right. There's a lot of ignorance out there about what actually is a healthy practice. Mm-hmm. How do you guys, work on that?
Well, one of the things that we've undertaken is a community health needs assessment, and we just wrapped that up at the beginning of this year. We had a big Truckee Meadows Healthy Communities Conference that helped to inform people in the community about the issues we're facing and try to engage them. And now our next step is we're in the middle of preparing a community health improvement plan. We had a number of needs that were identified in that health assessment. We had some significant populations. We've got a growing Hispanic population. We've got a growing aging senior population. We have many children and youth. A lot of their future health is shaped during their younger years. So we need to be looking at those populations and the issues that we identified, and identifying some priority areas for us to focus on and engage other organizations in the community, work together to address those.
Yeah, you guys just released your annual report, and it did outline a number of priorities. Before we kind of get into the contents of that, is there a number one priority, like a big thing that you're working on?
Well, tomorrow we are going to be, later in the process, we're identifying some top priorities, but I can't really tell you what's gonna be at the top when we get done. It's gonna be very challenging to get to 3 to 5 priorities. We've got so many needs, but some of the significant needs that we have are mental health. We have less than half the number of mental health providers that most communities across the nation have, and we have a attempted suicide rate in our youth that's about twice the national average. We have a large number of people that are food insecure in the community, and about 25,000 children in our community that are food insecure and may not know where their next meal is going to be coming from. We have also the housing insecurity. We've got income and poverty, and we have education as areas that need to be addressed. We know from the science and studies have been done that people that have lower levels of education have poorer health outcomes as a population. So the more that we can help to improve our educational system, I think the better off our health will be. And I really kind of look at this legislative session as a public health session with all of the wins and investment for education that we have.
Are you going to get an increase to your budget as a result?
We are not, but the school district will be receiving funds. And I think it's important to recognize that while the health district has the name of health and public health, our public health system is really throughout the community. And we have large numbers of organizations that play a role. The school district, our law enforcement are part of that mix, our hospitals, our social service entities. It's very all-encompassing. Right. And so our goal is really to try to work together with that public health system and try to move our community forward. Do
you have all the resources that you need, or I mean, do you desperately need more in your budget?
Of course we don't have all the resources that we need. Nobody does. And of course we'd like more resources, but that's not my pitch today. What we want to do is to, understanding the resources that we have, look at what the capacities are of the different organizations that we have within our community, both public and private and nonprofit, and how can we put together a plan where we're working together, aligning our efforts, using all of those existing capacities to try to make a difference. And I think if we can be successful in getting some projects going where we can demonstrate how we're working together, that's going to bring money. There are national foundations and other entities that will see something like that and say, hey, that's significant, and we want to help with that.
Absolutely. Okay, I just want to touch on a few of the other things that you guys do that are very important, maybe people don't realize. A big one is air quality. I mean, you guys monitor the air quality and you put out burn codes so people know when it's okay to use wood-burning fireplaces or pellet stoves, that sort of thing. Do you have issues getting people to comply with the burn codes ever?
Of course we do. It's voluntary, and we like to encourage people to follow the burn code, but we do get complaints and we go out and respond to those. But by and large, we do have a very high level of compliance, and we've done some surveys, and close to 90% of the population understands that program and supports it.
Yeah, that's good to know. Okay, my next thing, immunizations. That's a big part of what you do. Flu shots every year, and then all the way to things like measles, and there was obviously the big measles scare that happened earlier this year. Mm-hmm. How strong is the immunization program, and do you get resistance from the public, or are people pretty compliant?
Well, I think we have a good immunization program, and I want to do a little shout out for Immunize Nevada, are a great partner of ours in the community. And we've been longtime participants with them as well. We do a lot of collaborative work. We work with them to get out and do school-located vaccination clinics. We've expanded our immunization hours at the health district to 5 days a week, and we're on certain Wednesdays of the month, we're open in the evenings to improve access. But we're under the national target and the Healthy People 2020 targets. So we'd still like to improve the immunization rates. And I think flu in particular, and with school children, we've got a bunch of required immunizations that kids have to go to school. but flu isn't one of them. And so we have relatively low levels of vaccination for flu in our school children.
Now, real quick, we just have about a few minutes left, but I noticed in the report that Washoe County has a high infant mortality rate. Is there a reason you guys know of for why that is?
Well, we are actually engaged in trying to find out more about what's leading those outcomes. Some of it with the sudden infant death syndrome is very difficult to identify what the specific cause is. But we have a whole new initiative that's the fetal infant mortality review. And so that's a project that's just up and running the last year, and we've so far exceeded the number of cases that we wanted to be reviewing to explore that. So I can't give you an easy answer of why it is, but we're certainly working on that issue. All
right, well, we've just got about a minute left, but is there any message that you'd most like to get out to the public? I mean, if you could make everyone know one thing, what would it be?
I guess it would be make good decisions for your own nutrition and for your exercise. Visit our website, gethealthywashoe.com, or also the Health District website through the Washoe County main webpage. You can find us there.
Yeah, and you guys do reduced costs for things too if people can't afford certain things.
Absolutely. We have a sliding scale based on ability to pay, and so we are a safety net for the community. People should contact us if they're looking for services. We can either help them or refer them somewhere else.
Perfect. Okay, Kevin, thank you so much. I do appreciate your time.
Ariana.
All right, coming up on Face the State, we will talk to the chairman of the Pyramid Lake Paiute Tribe about what it's like to live on the reservation when we come back.